This is Giuseppe AMBROSIO speaking. I'm the Director of Cardiology at the University of Perugia School of Medicine in Italy, and we'll be briefly reviewing the issue of thrombin receptor antagonists. Why this is so important to have a lecture about that. Everybody knows about the thrombin's role in coagulation. This is something that has been known for so many years. And now there is also renewed interest in thrombin because of the availability of direct thrombin inhibitors to counteract coagulation. But this that I'm about to talk you is an entirely different topic. So we're talking about the receptors for thrombin that are present on a number of cells. This has nothing to do with coagulation, but with intracellular signaling triggered by the effect of thrombin. How does this happen? It happens because there are specific receptors that are called PAR, protease activated receptors, on the cell surface. Those receptors are activated by the catalytic action of thrombin that activates them and triggers a series of intracellular events. Depending on the cell type, these events could range from enhanced platelet aggregation, if we're talking about the platelet receptor, to smooth muscle cell activation, to vascular remodeling, to angiogenesis. So in a sense, thrombin is acting on a multitude of vascular events, not only linked with thrombus formation, but with the number of other things. And the net effect of this could be seen both in acute and chronic phases. In the acute phase, thrombin, in addition to inducing thrombus formation, would enhance platelet activation and leukocyte activation. And this might contribute to acute coronary artery syndromes or acute cerebrovascular events. In the chronic phase, on the long term, this stimulation of thrombin on vascular cells would promote vascular remodeling, enhance atherosclerosis, and accelerate vascular diseases. So there is a whole array of vascular events that can be affected by thrombin. Now we have also specific inhibitors for this phenomenon. They are called platelet activated receptor blockers. Some of them are already under clinical investigation, and one of them has also been approved for use by FDA in the United States. The hope is that in specific subset of patients, these receptor inhibitors may delay or block progression of vascular remodeling and intravascular thrombus formation. And the clinical trials available are very promising in this respect. In general, and in particular in some subgroups with a very high risk of vascular events, such as diabetic patients or patients with peripheral arterial disease. We will see in the years to come if this becomes a viable option for a number of patients.